The Idaho Department of Health and Welfare says nearly half of Idaho's 65 and older population has now gotten at least one dose of the vaccine, and here's how that breaks down. Health and Welfare Director Jepson says 47% of those 65 and older have gotten at least a shot. 44% of those between 65 and 74 have also gotten one. 51% of those between the ages of 75 and 84 have also gotten at least one, and 53% of those 85 and older have also received one. So now some are wondering, now that I have my shots, do I need a booster? And if so, when should I get it? It's the first question asked today in a town hall, but right now the governor says the state simply doesn't know.
We just don't know. We do know that viruses change. Right now, and we don't know whether it's going to morph into a seasonal virus. But just get the vaccine. That's the most important thing. If it gets to where the variants, where there's a booster, I know that Moderna, Johnson & Johnson, and Pfizer are all working on what would fit with the mRNA vaccine, the two of them, to make sure you have more coverage. Believe me, the innovation of our healthcare industry, the scientists that are working on that, if there is something, but just get the vaccine.
State says it administered a record-breaking amount of doses last week at nearly 60,000. In total, the state has administered over 76,000 doses. That's 376,000. Idaho Department of Health and Welfare also says Idaho is getting about 13,000 doses of the Johnson & Johnson vaccine. As we know, it's a one-shot dose. Unlike Moderna and Pfizer, they are two. The first two vaccines have to be super cold storage. Johnson & Johnson does not. Studies show the Moderna and Pfizer vaccines about 95% effective. Johnson & Johnson about 66%. And here's the key. Trials show that all three vaccines reduce the rate of COVID hospitalization and death by 100%. And trials in South Africa show Johnson & Johnson is also effective against some of the new variants. We don't know yet if that's true for Pfizer and Moderna.